Right, good afternoon. All those that are starting to come in, it's great to see you. A lot of the numbers are going up pretty quickly. I'm really excited to be here today. I'm looking forward to this session. We're gonna, as always, we'll give it a few minutes as numbers start to jump up. We can see who's coming on. It's great to see some familiar faces already, some familiar names rather. That are with us on this call today. So really excited to have this topic, a topic that's been quite pertinent in the current space that we are in. As you come in, those that have been with webinars with us before, we will know just some ground rules that we typically lay up front. And tell us your name in the chat. As you do that, please select all attendees and panelists as you come in. So remember, all attendees and panelists in the chat as you select, tell us who you are, your name, say hello. It's a fantastic opportunity to have some top experts joining us for this webinar that I have on screen. So my name is Brian. I'm the community manager at CFO South Africa. And it gives me great pleasure to welcome you all to this webinar that is brought to you by International SOS. And I'm really excited, again, like I said earlier, to have a lot of you jumping on onto this webinar. It's looking like we've got a lot of interest, and I see the names are also coming up. And hello, Val. Val picked me out and said, hello, Brian, so I'll return the favor. Thank you all. But as you come in, please say hello. And when you do that, kindly select all attendees and panelists so that we can all engage with the conversation at hand. I'm really looking forward to what's in store today. And I've got two absolute pros that are with us today that will take us through today's session. So still holding out for a few more minutes as I see the numbers are rising nicely. The attendance is looking really, really good. It's been quite cold where I am. I don't know how it is for most people, but it's been absolutely cold for me today. But I'm hanging in there, I'm hanging in there. And load shedding has been a bit unkind for me most of this week, but has taken a step back as I get ready for this session. I guess it's a sign of how important it is for everybody to listen in. So everything you need to know about the vaccine rollout, right? So if this is the webinar you signed on to, that you're hoping to find, you'll see it on screen, then you're at the right place. If you jumped onto a wrong one, it's okay. There's definitely a lot of things that you could learn today. The national rollout of COVID-19 vaccines is creating a lot of challenges for countries, most of you already know. Employers whose businesses have been severely affected by the pandemic are eagerly, and I say this in bold, are eager actually to return to some form of normalcy and want the employees to take the vaccine, right? However, employers should tread carefully, and this is why I've got this great team from International SOS. Should tread carefully as the vaccine campaigns are regulated by government, and not all employees will even want to take it, right? Which is a crucial point. Not everybody perhaps wants to take the vaccine, which is, hopefully we will get my two guests today to unpack what this means. So there's this cloud of uncertainty that employers have to ensure the health and the wellness of their people, and safeguarding sustainability of their businesses at the same time. So it's a bit telling, where we are in a lot of confusion, and I'm hoping we can get that ironed out today. You'll leave here with some pretty good insights. So once again, my name is Brian. I think we safely say we've got a fair quorum to getting our teeth into the topic at hand. So this afternoon, I am really fortunate to have two absolute experts who will unpack the topic and share their insights and practical advice on issues not only around COVID-19 and its implications, but also shed some light on the options that HR practitioners, which a lot of you on this call have regarding the vaccine rollout, impact on health, safety, and wellness of employees. So with that, I wanted to introduce my two guests, and I'll start off with Anneline Booyse-Mofokeng, who's the Security Director of International SOS. Anneline, you can unmute and say hello.
Thank you, Brian. Good morning, everybody. Good afternoon, everybody. Sorry. Yeah, I'm so happy to be here, and it's always great for us as an international organization to empower. This is all about empowerment with information, making the right decisions to support, and it's an absolute pleasure to be here, and I'm looking forward to the session.
Thank you for that, Anneline. We're also looking forward to hearing from you today. And my other guest is Dr. Chris Van Straten, who's the Medical Director at Clinical Governance Africa at International SOS. Dr. Chris?
Hi, Brian, and thanks all for joining the call. Really an honor to be here, and I certainly hope we can shed some light on some of the challenges and share some of our own experiences over the past year in dealing with COVID. Thank you.
Thank you for that, Dr. Chris. So Chris is going to share with us how the vaccine rollouts have impacted wellness and business performance in other countries. So we hope that the work that he's done, we can apply to our businesses here in South Africa and perhaps take some insight on what that looks like. So I wanted to sort of get a sense of where people are, but I'll call on Dr. Chris. And Chris, you can sort of start off, and then I'll give you the platform because I know you prepared this presentation to kick us off. And please go ahead, and over to you. Thank you.
Right, Brian, thanks so very much. And just first off, can you see the screen and the slide deck?
Yes, I can see it. And if you cannot see the screen, please throw in a message in the chat. We'll get to it, but I definitely can see it, and I can see Anneline is confirming that we are good.
Good, so excellent, thanks so much. And as Brian said, I am one of the regional medical directors based in Johannesburg for International SOS. And we, as an entity, have a global footprint. And in essence, we assist global clients in many of their health care or health aspects. My particular remit is medical services. In that instance, we have remote sites with medics on those sites, assisting our clients in running some of their operations. So as Brian has said, the discussion will mostly be around the current update in Africa, sort of a broad overview. I'm going to zone in a bit on South Africa. We'll look at some of the trends we've seen globally with the rollout of the vaccine and South Africa. And then we're going to open up for some discussions. And I'm going to keep my talk to about 10 minutes so that we can spend most of the time discussing and taking some of the questions that have come up. So good. The first thing I want to emphasize is you'll hear this if you've been sitting in on the WHO conference calls that have been happening sometimes daily or weekly. You'll hear this: no one is safe until everyone is safe. And that, for me, is extremely important. And it's important not just from the vaccine context, but it's all the other measures we've taken thus far and need to continue taking. And that includes the masking, distancing, and isolation if and when required. And I can't overemphasize that. I'm going to give you a case example in a couple of minutes. The other thing that we will be touching on is some of the media, I want to use the word hype, but media-driven misinformation, disinformation, which has certainly caused a lot of anxiety, a lot of stress, and I think in some instances, poor decision-making. And the reason I'm saying that is being in Africa, having the Africa footprint, but also being connected daily with my colleagues globally, I think often Africa or South Africa has taken this negative sentiment that sometimes creeps in, and you hear things like, it's always bad or it's not working. And I find that ironic because of a recent publication in The Economist, 5th of June, saying at last, Europe's vaccination campaign has gathered pace, and with supply bottlenecks starting to ease, but Eastern Europe, however, still lags behind. And with that, emphasizing that the challenges have been global challenges. We've certainly seen some remits struggling more than others, whether that's due to political reasons, geographic, or financial. However, it's been a global struggle, and I've taken heart, though, at how different and the different regions have come to the fore, and we're tackling this pandemic. The other thing I want to highlight in this particular slide is Israel. There are a couple of outliers in the pandemic. And the one is certainly Israel, in that they have vaccinated such a massive part of their population and done it quickly. And part of the reason they could do that, small country, access to resources, and because of their sort of cultural norms, they were able to roll this out effectively. And we've seen some really interesting things coming out of the data over the past couple of weeks, and that includes reduced morbidity and mortality, reduced hospitalization and deaths. We know the vaccines, all of them, are really good at reducing your risk of severe disease. What we still don't know 100% is how much protection they give you from actually getting COVID. But what we're seeing from Israel's data is it certainly is reducing the amount of infection in the population. The next slide, this is from today's update. It's the Africa CDC. So like the European Union, like America's CDC, we have the African CDC, which is getting in the data daily, weekly, and monthly from the different member states, collating that data and allowing us and researchers to see and track what are the case numbers, how are we doing as a continent, and the different countries within the continent. And I'm sure most of you are aware of some of these numbers. The total cases on the continent getting close to 5 million. The total deaths at 133,000, and recoveries at over 4 million. The total tests done at 50 million. And we'll get into some of the vaccine numbers in the next slides. There are a lot of questions that can come up around this, but I'm going to hold back just so that Brian still has some questions to ask me at the end. And Brian, you're welcome to move me on if I get too carried away. It's a topic I've spent a lot of time reading about. Okay, South Africa, country summary. First things first, I know that the government is taking criticism from a lot of sort of different directions. There were some hiccups in the beginning as we saw the new variant coming in. The science is changing, the data is changing. But why I'm pleased is I'm looking at this number here, the 1.5 million vaccines administered, and that was updated yesterday. And I gave a very similar talk about 2 weeks back, and that number was sitting at just 300,000, and that was mostly healthcare providers. I'm a healthcare provider. I got my vaccine with an initial rollout of the Johnson & Johnson. And one, I got to say this, I had to register twice on the digital system, but once that was done and the actual going for my vaccine was smooth and it was better than I expected, and I was really pleased. My in-laws were vaccinated today down in the Cape, and apparently it went very smoothly. So this is good. So let's just look at some of these numbers. We know at the moment there are 66,000 active cases. We know that in the country as a total, we have over 1 million recoveries. We have over 1 million or 1.7 identified confirmed cases. And we at the moment, as a country, seem to have the highest burden in terms of deaths. But I think that's also because we as a country are reasonably good in getting in the data, collating that data, and reporting on that data. The recovery rate still sitting around the 92% mark. In other words, if you get COVID, most people, if you're fit, healthy, is still likely to recover. It's the individuals with comorbidities that are at risk and who tend to get severely ill. Another point I want to bring up is this. As a continent, we have lagged behind somewhat in terms of how we, or our capacity to produce vaccines. And there's been a lot of international discussion about easing off on some of the intellectual rights. And there's a South African doctor who graduated many years ago, moved to America, became a billionaire, and one of his companies is actually now in discussion with our government to actually start producing, and he wants to give back to South Africa. So we have Elon Musk, an ex-South African, making huge waves in America, and we have this South African doctor now also getting involved to help South Africa and make sure that we can ramp up. So there's some interesting things happening in the background. Good. International SOS, part of what we do and do for our clients, we have experts globally who are tracking and monitoring the situation and also collating data which is not always available privately or publicly. And this is just one of the data sources that I have access to. And we use this daily so that we can update our clients as to what is happening. And what I've done here is just to select some of the African countries where I have been involved with our clients in discussions and also enabling us to compare, for example, what is happening in Angola or South Africa or Zimbabwe compared to what's happening, for example, in the United States or America. So, and here I'm just going to emphasize quickly a couple of interesting things. So let's look at South Africa. We know we've got increasing activity. And the numbers coming out of the Gauteng parts of the Cape and the Orange Free State or Bloemfontein area suggestive that we are entering our third wave. So we need to be cognizant of our COVID fatigue. It's real, we're tired. But we also need to go, hang on, we've done a great job and we need to continue masking. We need to continue distancing and taking care of ourselves. The numbers are going up. And the other interesting thing too has been the number of new cases going up. But also going up is the number of vaccines that we now have in the country, the number of individuals vaccinated. And as we've said, from personal experience, but also the numbers coming in, more and more people are getting vaccinated. But this is still too low. We want more people vaccinated daily, but that number's coming up nicely. If you compare that to America, they are vaccinating now fast. They've got a huge amount of vaccines, and they are now starting to donate their excess vaccines to other countries. And the WHO is very involved in that. And they are now seeing decreasing activity because of social distancing, mask wearing, and the vaccinations. Good. I just quickly want to talk about some of our own experiences with our clients. I have a client who is a European client with several assets in the African region. These are onshore and some are offshore. And the reason I would like to talk about this just briefly is it's been a challenge for all of us. How do we assist this client with keeping their assets safe, keeping the projects running, keeping their staff safe? And the other big challenge for us hasn't just been COVID, it's been malaria, because many of these assets are sitting in sub-Saharan Africa. And what we did there was a combination of, we have consultants in the business who can go out, do a site health review, sit with the client and look at where potential risks could be to health and continuity on the projects. And we've then been able to, for malaria, we had education for expatriates coming into let's say South Africa or Mozambique or Angola, and training on malaria prophylaxis, how to wear the right long-sleeved clothing and mosquito nets, and also if someone should become ill with malaria, we have assistance centers they can call, and if an air ambulance was needed, if someone got really sick, we could make a plan to medevac that individual. And what is incredibly satisfying at our recent QBR with the client was to be able to say, it's amazing we've had 0 malaria cases on those projects. And with COVID, we've also had 0. And I couldn't believe the numbers at first, so I had to go double check. And this is the methodology, part of the methodology we use to get to that point. And it's not always a simple process, but it's a process of analyzing the workflows, it's analyzing the movements on and off the sites. It was having backup plans if someone should get ill, screening, pre-deployment if someone's coming from Europe. How do you test before? What are the country regulations? Once you're in country, do we test again? If you're offshore, how can we keep people safe? And touch wood, and to date, we've kept these assets COVID-free and malaria-free. And I'm very proud of that achievement, because if we've looked at some of other projects that have run without this kind of intervention, we have seen cases of outbreaks and operations certainly being impacted by that. So that's just a quick overview of that. And I think that will bring us, hopefully not too much overtime, Brian, and to the point where we can start discussing. Would you like me to stop sharing at this point?
Yeah, thanks for that, Chris. Dr. Chris, you can stop sharing. Actually, before we start getting into the meat of this discussion, I wanted to get a sense of, where people are in terms of, well, as HR practitioners, what are you doing for your employees, right? And what is at play? So for the next couple of minutes, 2 minutes, I'm going to run a quick poll. And I'm just going to, it'll allow me to get a sense of what people are. You probably see it coming up on your screen, on your screens as well. I want to get a quick sense of, well, question number 1, while waiting for vaccine rollout, how do you protect your workforce against COVID, ensure business continuity? So some of the things that you're doing, what are some of the things that you are doing in your businesses? There's a couple of options. So of what's happening around. So there's 2 questions, 2 quick questions that will set us on our way to a conversation as we begin to unpack. The second question is, in the view of a phased rollout of vaccination, for vaccinations becoming a reality, and with so much fake news around the world, have you considered how your organization will educate employees? 2 questions. I want to get a sense of where people are currently sitting before we unpack and peel the layers of this onion. So 2 short questions for you on screen. Please participate as much as you can. It'll really kind of give us insights as to where we are. I mean, this is a very small sample, but it'll give us where we are, at least as a group and as HR practitioners that are on this call, that are involved with a lot of employees as well. You're impacted both at home and at work, some of these situations. So we're good to know. So it's great. I'm crossing 50% of you are responding, which is if we can get to 70%, I'll be really happy. 70% will be really good. So I know some of the question seems a bit long, but we need something more to think about it. But yeah, so what I can see, at least from question 1, 50%, we have a plan to ensure screening, social distancing, and monitoring of suspected and confirmed cases. Okay, so plans are in place. And there's very low kind of threshold in the first question. All employees work from home. So there's a mixed bag there. So it's interesting how that will really play out. And then on question 2, we're having about 50% of us really saying, yes, we have an internal program already, right? But still, we're talking about what? That's close on 20% saying no, but they can contact a dedicated person. Either it's no, they can contact a dedicated person, or nothing exists at all. That's 20%, which is actually quite significant, I feel. And also on the second question, yes, but all employees need to educate themselves and know that they are eligible. So very, very key points. So he's sitting on 62%. I'm going to give you a quick 30 seconds if you're still waiting to vote. So pick one, and then I will end the poll. I'll end the poll so we can get Anneline Booyse-Mofokeng, who's also, the security director at International SOS. She might be getting a bit cold, so I need to bring her in into this conversation. So I'm going to close the poll for now. And ladies and gentlemen, thank you for taking part in that poll. And I will, as we go along, please feel free. I see questions already starting to come up in the chat. Post them in. We'll try and pick them up as well from the chat if it's not already covered in the next bit of the conversation. But thank you for taking part in that. And so, just to kick us off here, I'm going to start, Dr. Chris, just because you were presenting, I'm going to start with you quickly and just ask you this question quickly. Can we procure vaccines in SA to administer our employees based in another African country and trust that the data that's coming out from the rest of Africa and indeed the world, given all that data you shared for us, it's a mixed bag from the various countries?
Yeah, good question. I just also want to make sure I heard it correctly. I think my line cut out a bit, but essentially was it, can we procure vaccines as a company to administer?
Absolutely, yes.
Excellent question, and it's one that we've had nonstop for several months from most of our clients globally, actually. And the answer is this: at the moment, no. At the moment, it's just governments procuring in coordination with the WHO. And for Africa, it's mostly going to COVAX. And the reason for that was to try and ensure that we keep it as equitable as possible and that we're not seeing super wealthy entities coming along and being able to snap up the vaccines and drive the prices through the roof. However, that being said, I think there should and will come a point where private entities will hopefully be able to start assisting either in the distribution and in terms of administering, and hopefully at some point to be able to procure, distribute, and administer. And International SOS has been engaging with some governments globally to see when that point might come so that we could assist our clients in reaching that point. What we certainly have done in 2 or 3 African countries, and it's for clients where, for example, 1 or 2 of the embassies were able to procure vaccines because of their political affiliation. And we were able to help them administer the vaccine. So at no point were we procuring, but we were assisting in the administration of the vaccines. And in South Africa, I think it will be some time before a private entity can purchase and vaccinate. And that's purely because of the limits on supply. Does that help?
Yeah, it certainly does. I have a question though. I mean, just because you mentioned equitable, right? You know, the reason this is done, it hasn't quite panned that way. But I want to park it, because we still have the most powerful companies that have hogged, I believe, and I put this in quotation mark, hogged the vaccines. But I'll park it. I want to bring in Anneline quickly. And this is purely based on the poll that we've just run, right? And you saw it was quite a mixed bag, but it was all kind of, there was some saying, well, the employees should read around themselves and figure it out. How far should employees or employers get involved, especially given this whole life, work integration? Some are working from home, others are not. how far can you go as an employer?
Thank you, Brian. Thank you for the question. I think what I would like to start off with is COVID has really brought us to a point where you have to break the silos. You don't often see security managers or chief security officers being part of either a crisis management team or a part of engaging often with HR unless there's an investigation to be done or want to verify some information. But this is the time where you need to establish that small team in your office, because inevitably for the security manager, your perimeter have extended now to the residences as well. Before COVID, typically you would have the office to take care of and the office building to take care of, but now your responsibility is extending to the workplace, to the homes, which has now turned into a workplace because many staff members are working from home. And rightfully, as you ask, how far do we have to go? Because often we get a question that, but this is my private residence and my employer cannot tell me what to do at my house. But you need, as a staff member, as an employee, you need to understand that your organization have a responsibility, and we call it a duty of care, to ensure your safety while you are at work. And whether that workplace is in the office or away from the office, I mean, this can easily be compared to also while you are traveling. Just because you are out of the office doesn't mean that the responsibility of the employer stops. So now it's very important to put that team together, which will be your chief security officer, your security manager, your HR manager, your wellness manager, or a wellness partner, and get a group together to make sure that you respond to all elements of the challenges that is associated with this vaccine: home security, mental health, and of course, duty of care from the employer side.
Okay, good. Let me stay with you, Anneline. And I suppose my next point is really linked to, how, well, firstly, you've explained how far as an employer can go, but you saw from the poll, at least over 30% of the people are already working from home. So what kind of recommendations do you want to give to employers to sort of help them adapt the work environment or the workplace to create a safe environment for their employees specifically?
Yeah, Brian, I think what is absolutely critical in the current space with COVID, we speak about the blind spots of COVID. Everybody's so COVID focused and very much medical orientated, and we tend to neglect the security portion of, or the security impacts that COVID is having on the workforce, for example. So crime did not go away, political unrest did not go away, civil unrest did not go away. And those are elements that still needs to be taken into consideration when you plan or when you put something together to support your workforce. And for example, some of the recommendations that we have put forward to our clients is the critical aspect is definitely a residential security survey. That is something that is that needs to be done whether you are employee or not. That is just for yourself, for your own security, especially for single females, and especially for families. And this is where you get a security professional to come out, do an assessment of your residence, tell you where the weak points are, where your threats are, and can help you to put the necessary security measures in place to make the home a little bit safer. But additional to that is also training. As you know, a lot of security threats and risks are associated with human behavior. How exposed are you? How do you make yourself vulnerable? And it's very important to bring them in training to prepare staff members to work from home, what to do when something goes wrong, who to call, who to respond to, and then having an incident management plan in place that when something goes wrong, the employer can respond very actively. And this incident management plan is not just for security matters, but also for medical matters. If something happens, maybe just to alert those of us who are in South Africa, the crime states have just recently last month came out, of which our two major challenges are still, of which one is still home invasions and home robberies.
Thank you for that. And I guess that explains the question that I had earlier when people are saying, well, we've got a security director from International SOS. Your insights are very, very welcome. And thanks for chiming with that. Dr. Chris, I'm going to call you back. And remember, I said that the whole equitable system didn't quite pan that way. And we still have more countries having more vaccine than others, and that will create some kind of excess, I suppose, in the future. What are your thoughts on that?
Oh, complex topic and a long one. I mean, I don't think we have 6 hours. Yeah, the intentions, especially of my understanding with the WHO, was to try and keep it equitable and to move it forward in that way. And then the reality is we've seen, especially the developed countries, parts of North America, parts of Europe, certainly now being able to access excess amounts of vaccines. So I think Canada could vaccinate their population perhaps twice over. What is very encouraging, though, is to start, and I hope it's more than just media, and I hope it's more than just political, that they're actually now starting to donate excess vaccines. I know New Zealand has, I know Australia has, and that's good. That's heading in the right direction. But I think the other part of it, and we alluded to it at the beginning, where we also need to be at a point where we can produce our own vaccines. And I don't know if you were following the headlines the last couple of weeks, South Africa was declared polio free by the WHO in the last months. That's amazing. My grandfather's generation, every family knew someone who had polio. I've known 1 or 2 people, elderly, that might have had polio. That's an amazing achievement. And it's thanks to very effective vaccines. And I think there's a lot of negotiation. I'm obviously not privy to all the aspects of it, but there certainly is a movement to get to a point where we, as South Africa or as the continent, can start to produce and then distribute. And again, I'm a bit of an optimist. I'm also a nerd and a tech geek. If I just think how we've progressed, we've built these amazing vaccines, and they are amazing. And it hasn't been in a short period of time. A lot of people going, but they were made so quickly. They weren't. This technology has been developed over the last decade. The Ebola vaccine is an mRNA vaccine, and it's astounding. And that technology was just tweaked and modified for the coronavirus. And I'm hugely encouraged by how quickly we've been able to figure out the genome, start developing these vaccines and the rollout. And I'm hopeful that we will, as a country and continent, start to be able to produce and distribute. Does that help?
That definitely does help. Chris, I mean, I suppose the next point, and perhaps, Anneline, I'll let you chime in, and I saw a question kind of linked to this coming in the chat as well, is, what do we do, or what if an employee cannot be vaccinated for whatever reason, or does not want to, due to, whatever personal reasons? What do you do, 1, as an employer? 2, and what as a grounds does an employee have to refuse the vaccine, and what kind of implications will that have on the workplace? I'm gonna start off with you, Chris, and then I'll hear Anneline's insights on that as well.
Brian, extremely good question, and a very complex question. So the first part, let's deal with, just this huge spectrum. So on the one end of the spectrum, you have a geek like me, right? And the geek is vaccinated. And I've also spent my career studying this. So it's not a matter of belief, it's a matter of, well, I guess it's belief, but it's years of knowledge. It's being able to talk to experts globally. And when the vaccine was offered to me personally, I didn't hesitate. It was, I understand the logic. I want to protect me, but I also want to protect, for example, I hadn't seen my mother in over a year and a bit. And after I was vaccinated, it was the first time I felt comfortable in being able to start visiting elderly people, including my mum. So that's the one part. That's kind of the emotional, but also contextual. But I also totally understand that there are individuals who aren't, have different background, different feelings, different beliefs. And we must be respectful of that. But the analogy I would use, and I think it's reasonably good, the seatbelt in a car is a really good idea. It really is. And because it's just, we know from the data and the evidence that if a human being stays in a seat when there's a car crash, and it restrains your head from not hitting that windscreen, your chances of dying are significantly reduced. And the same with the vaccine. It's that same kind of analogy. And I think the resistance that I've seen and heard has really been about people not understanding, or perhaps us as a medical community not engaging in a way that makes it easy to understand, or using language that people go, okay, I get that. That totally makes sense. It's also one reason why I talk freely and openly about would I vaccinate, have I vaccinated, and why I vaccinated. So I think we really need to be respectful and really communicate in a way that explains the gravitas. I think we'll get how important this is, but we need to go that extra step and really explain some of the nuances and why it's so important. And then also, to the best of my knowledge, this vaccine isn't a legal requirement. You can choose not to at this point. The childhood vaccines are different because they've been there for longer. We know that there are countries that had polio outbreaks about 15, 20 years ago, because there were people going, and we saw it in East Germany and in parts of Namibia, we're going, we don't take vaccines. I don't want my kids to have it. And then there was this outbreak. And I don't know how a parent could ever look their child in the eye and go, Daddy had protection of a polio vaccine. That's why Daddy can walk. But you're in a wheelchair for life because Daddy chose not. I'm sorry, but I personally can't do the maths on that. So I think it's not at the moment law. It's too early. I certainly, though, as a healthcare provider, as someone who's read the science, who's looking at the research, who's advising clients, who's advising family and friends, I have no hesitancy in getting vaccinated. There is, however, a very small group where there might be pre-existing medical conditions. And there it's different. And there we still have a lot to think about and to discuss. And in that context, the onus is on us. Because remember, there's a term called herd immunity. It's not something I'm fond of talking about because I don't think we have in all the data yet. But we do know part of the reason polio has been eradicated, measles was squarely under control in many countries. And where we've seen these outbreaks, and recently in parts of America, is where people have gone, well, actually, I've never seen measles. I grew up in a community where everyone was vaccinated, so I'm not going to vaccinate. And I think with COVID too, I'm thinking of the elderly. I'm thinking of people who have to take chemotherapy. I'm thinking of people that have comorbidities. I'm young, fit, and healthy, so I'm vaccinating for me, but I'm vaccinating for them too. And I think that's part of the big message. We've got to think the bigger picture. Does that help, Brian?
Yeah, it's certainly, food for thought right there. I mean, and I love the analogy of the seatbelt that you use. It's been around for years, but some people don't wear it. I suppose that's the position we're in. Anneline, I'm going to bring you in quickly, and let's talk about this, on the grounds that employees may or may not have to shun the vaccine. I mean, what's the situation there? What are there any grounds that they could refuse to be vaccinated?
Thank you for the question, Brian. Very critical at this point. And as Dr. Chris have mentioned, currently no legislation around the vaccination and the application thereof. Are we going to see any development in that direction? I don't think so. I think where we are at the moment is, and Georgina has put it very clearly in one of her chats, she says she hears so many stories. And it's all about information. It's all about how we are conveying that message. And like Dr. Chris, the example of the seatbelt is just excellent. Your chances of not making it without the vaccine is greater than your chances with the vaccine. And also, This brings in the whole issue of fake news and fake information, and people who just put stuff on internet, on Facebook, Twitter, wherever they can post, and just making up stories, around campfires and dinner tables, and really have no credible information. And this is what I would like to share with the team today. Other than the residential risk survey, the next best critical thing is that criticality of having credible information and being able to access that information, and then what you do with that information and how you transfer and translate that to your staff and to your workforce, making them understand that the benefit of that is much better. Unless we're going to have a case in front of a labor court that will have to be forced, will probably have a forced hand in making such a decision, unless we're going to have human rights committees and human rights organizations coming to the fore and pitching for that choice, to make, we will not see a direction into legalizing or legislating this. But very interestingly, you need to also understand which country, which organization you are looking at. You're potentially going to see a direction of airlines refusing to take people who have not been vaccinated. You're potentially going to see an isolation, because I can almost for certain say that those who will not be vaccinated will be less than those who will be vaccinated. And you will then see a return of almost some kind of, to put it in context, a xenophobia or some form of isolation and sort of, keeping those who don't have or have not been vaccinated apart from those who have been vaccinated. And I think once people understand what the impact of that will be, you may see some shift into the rollout of the vaccine towards specifically those who have challenges with the vaccine.
So, Anneline, I'm going to double click on the point you made with regarding to fake news, right? What's out there, there's not a lot of information, there's some anxiety and all this stuff that's happening. How can ensure that employees are actually getting the right information or have access information? Let's set the record straight there. Where do you get accurate information?
Brian, once again, remember in the beginning I was talking about the team. This is time to bring in your communication specialist as well, or your marketing specialist for internal. Everything starts at home. So you have to have a communication plan in place in terms of what is the stance of the organization, what is your role, and what is the information that you would like to share with your staff and with your workforce. But other than that, part of that communication plan needs to identify or needs to showcase that everything that will be shared on your work platform or on your work communication platform is information that is credible, it's information that has been verified, and it's information that comes from a source that is having the facts. And that is very important. And it is a part of the rollout. And I always fascinated with the data and stuff that Dr. Chris and them have. But how do you use that data to your benefit to be able to enhance and strengthen your communication plan with your workforce? So it's all about credible information. I mean, just with the vaccine rollout, Dr. Chris have mentioned, there were some glitches on the app that the government had, and we all know there was some hackers trying to get into the system. That is how vulnerable we are. So even when you do get that notification, when you do get that information to do a vaccine, pick up the phone, ask your health professional in your organization, ask the champion. Right now, every company should be having a COVID-19 champion or a health advisor in-house that people can go to and say, this is what is happening, this is the information that I've received, is it credible? Where they can just bounce off instead of reposting and resharing it all over the platform, the social media platform, and having all kind of questions and creating anxiety around it. So it's all about having that person, equip that person, and as I said in the beginning of my introduction, having sessions like this where you absolutely empower your management team to be able to confidently speak about what is happening, how it's happening, where it's happening, and where the places are that workforce can go to have support.
All right, thanks, Anneline. I'm going to go to Dr. Chris quickly, and the question I'm going to raise for you is actually a question that's been posted by my good friend Abe Kotle, who's also in the audience. Hi, Abe, and his question is, what's the outlook in respect of a ramp up of the vaccination program? But before you respond, I want to double it up with another question, right? So Abe is talking about a ramp up of the vaccination program currently, but we also know that the bulk of the workforce within South Africa is below the 60, and we're only currently vaccinating those under. So what should be happening? I mean, there's a bit of confusion in that. Should we be accelerating? What's stopping us? What are the challenges? And what should we expect?
Right. So I wish I had a crystal ball and I could just peer into the future and go, this is what's going to happen. Okay, first of all, you use the word should. Well, if I lived in a world where the shoulds happened, I'd be 6'4" and playing basketball. So the should aspect is, yeah, what should have happened. But again, I'm reluctant to say it because it's so complex, but it would have been great. We hit that 1 million plus vaccines in South Africa. It would have been great if we could have hit that 2 or 3 weeks ago. And again, we all do this. We compare ourselves to Zimbabwe. I think Zimbabwe was a bit ahead of us, and other African countries where South Africa's always been the powerhouse of healthcare. We've always been the powerhouse of infrastructure and being able to manufacture, deploy, etc. So I think it's fair to say some of us were disappointed, but also understand why some of those hiccups happened. And some of those hiccups were around, remember, we were going to get the first batch of vaccines, and then that second variant came along, a curveball, and we found that that initial batch of vaccines, they were still effective, but less effective than the Johnson & Johnson against this variant. So there the government had to put on the brakes. I get the science, I get the maths, and it probably was the right decision, but that slowed us down. The government too initially was perhaps, but again I say perhaps because we don't always have the full picture, slightly late in getting to the negotiating table with COVAX. However, and maybe a bit biased, but my own experience there was I registered, I went to go get my vaccine, and I was expecting to sit, there were a lot of people at the hospital, and I was super impressed by how efficient and how quick the whole process was managed. And that was great. It was really great. And it wasn't just my own story. There are many of the healthcare providers. My wife's also a doctor. She's working in a government hospital and has done for the last 4 years. And they were up against some really tough stuff. But she got a vaccine and she got it quickly and effectively, and so did her colleagues. So on the one hand, I want to say sure, but on the other hand, I also want to balance it out between, we also have to be pragmatic and realistic about how complex this is and how much is being done. But yes, more can be done. And I think we want to get to a point where we are manufacturing. And I am hopeful that we will get to that point. But exactly what that timeline will be, I'm not sure. Does that help a bit, Brian? It's not a straight up.
It does a little bit, and it kind of explains the environment of that we're in. I mean, with the anxiety, it's not always crystal clear for most people, but yet what I'm getting is, you know, you're better off wearing that seatbelt right now. That's the message that I'm definitely getting.
Yeah,
I'm going to go to the chat quickly. On again, there's a question from Chidi Dabula. And the question reads, with the current vaccine rollout, especially with the 60-year plus, there's 42 days waiting period from the first jab to the second jab. Is there a health risk given this long waiting period? Dr. Chris?
That's a really good question, by the way, and really well phrased. It's something I've thought about, but not in the way that was phrased, and it's good. First off, there's a health risk just being human on Earth right now in COVID, all right? So the first step is, and I want to get back to why I put that case example into my slide deck. And that's this thing of, we managed to keep the client's projects COVID-free to date, and there was no vaccine. And that was over a 12-month period with no vaccine, just distancing, testing, isolating, screening, and picking up people who potentially been exposed or sick, and quickly and effectively dealing with that. And I wasn't convinced we were going to pull it off, Brian, but we did. So, and I don't think it was just luck. I think, well, I know a huge amount of work went into that. So when it comes back to that question, we've got to continue what we've been doing. And I think the numbers in South Africa are starting to go up for a couple of reasons. By the way, this massive wave we saw in India, there are a couple of reasons behind that. The one was a new variant. The second was, and it's partly political, the elections were coming up, or by-elections, and people were kind of going, well, you know, we're doing well. We've got religious festivals coming up. Let's, you know, you can stop wearing masks for a bit. You can perhaps aggregate more. And then we saw this absolutely devastating wave in India that overwhelmed part of the health system. And it's really been bad. And we, in South Africa, need to now, looking at the numbers picking up in the last days and weeks, we can protect ourselves. And I'm sorry if it's getting boring, repetitive, but I can't emphasize it. Masking up, it protects you, but it protects others. It's the hand washing, it's the working from home if you can, and thinking of others so that you're protecting them. I can't overemphasize that, that has worked, and the screening that Anneline spoke about, and engaging in that communication, because where it's been done diligently, it has definitely worked. All right, so more now for that particular question. So when you get that first jab, your immune system will start making those antibodies. Your innate, your T-cell immunity will start recognizing and creating that memory that's required to prime your immune system. It's not going to give you the full protection that you want, and you're only going to get, as the person who posed the question said, it's like, it takes, once you've had the second jab, it's going to take up to 2 weeks before your immune system is fully robust and ready to fight. So sure, there is a risk, but at no point has anyone said, or should be saying, hey, you've had your 2 shots, you go to a disco now, you're free to go. That's not what anyone's saying. What we're saying is, please get the shots as soon as you can. And once you've got them, you need to continue masking up and continue distancing. Because here's what we know. We know that there's plenty of data now, and it's robust data that says, once you're vaccinated, you've got a very high percentage protection from severe disease. But what we think has happened in 1 or 2 instances, but how big that is, we're not sure yet. Part of your immune system sits at the back of your throat here, and some of those receptors that the virus binds to. So technically what can happen is the virus can get to the back of your throat, start replicating. It can't spread easily to the rest of your body because you've got that immune force that your body's built up because of the vaccine, but you could potentially still spread to others. So you might not get really sick, but you might be able to transmit. How big that might is, we don't know yet. That's data keeps coming in with research. So me personally, I'm way less stressed than I was before I got the vaccine. Right? I became a hermit. Really, I became a home-dwelling hermit. And my wife, when she got home, she's a doctor, and every day she was managing patients. So she had to go have a shower, get clean, make sure those clothes are in the separate washer, and then and only then would we have any kind of contact. Now that we're both vaccinated, we're still doing that, but I'm just less stressed about it. When I see my mom, for example, I was only seeing her outside, okay? And things like that. So we still got to keep thinking bigger picture. And with time, hopefully we'll get to a point where that will become secondary, but we're not there yet. Does that help, Brian?
Dr. Chris, I'm certainly less stressed having spent the last hour with you from the insights that both you and Anneline have provided today. This topic is immense. There's a lot of questions that I wish we could tackle all of them all in one crack, but I wanted to thank you all for coming on today and thank the participants. Unfortunately, our time has kind of run out, and we'll probably have to end it. There's some questions that will come in. We'll see if we can catch them at a later stage, but thank you all for coming in. Anneline, I'm going to let you have the last words as we wrap up for today.
Thank you, Brian. I think just a reminder, put that team together. Fighting COVID is a team effort. It's not a solo effort. And make sure that you include all the necessary stakeholders in that team to be able to ensure that your duty of care is not just COVID focused, but is really a broader scope to make sure that you support your workforce on all levels. That's all for me. Thank you, Brian, and well done, and good luck to everybody.
Thank you. Hey, everybody, did you know the race to reskilling is on? Don't be left behind. Our next webinar is up. Building skills infrastructure for learning culture for agile workforces is coming up next. And with that, I would like to thank all our panelists for today. Fantastic information. Please feel free to go onto their website. I'm sure there's loads of information that you can get there, and be able to reach out to us at chro.co.za for any further insights. But thank you very much. And from all of us, good afternoon.
Stay safe.
Thank you.
Bye.
Bye-bye.